Hello, I'm Dr. Jason W. White, a family medicine physician with Community Physician Network since 2021. I practice in Anderson, Indiana on the hospital campus at Community Hospital Anderson. So we got a lot of options for specialist care. So if our patients need referrals to our specialists, we have them nearby, we know them. In our practice itself, we see all ages. And we're family medicine, we're not gonna push anyone away. And we do some procedures ourselves. We'll do some simple skin things. We'll do a lot of women's health procedures. But mostly what we do is help coordinate patients' care, help patients find access to care. Like there's a lot of need in Anderson. So we spend a lot of time trying to help them figure out which medicine will get approved by their insurance, which medicine is gonna be cheapest, where they can find it. We have a whole team approach to that. We have clinical pharmacists, we have nurses, social workers, and the whole approach is we're your access point. We're kind of your coordinators. Our goal is to be where you can come for questions, for small things that crop up, a rash, ache, pain, cold, flu, and for your more long-term big needs. How do we plan for the future? How do we coordinate getting your meds in the right place, getting them so that they don't interact with each other, and making sure you and your specialists, if you have lots of specialists, communicate well so we can kind of be the hub. I do have some small extra skills. I speak Spanish. I'm not fluent on the street, but in the clinic I'm very fluent because I've mostly learned it while in med school. And so far that's worked out, and I really enjoy being able to serve my patients that way. But then I also was in an underserved track in the residency at Community East. So I've spent my whole residency and onward career learning how to meet those patients' needs, learning how to work with folks who don't have a lot of resources to pay for meds. How do we find the meds for cheaper? How do we bring in a bigger team? So those kind of challenges are just bread and butter for me. It doesn't mean I always find a solution because sometimes the system just isn't fair. Hence why I also got into my medical director role to try to solve those bigger problems. But it does mean that if you feel like you're struggling with that part of the healthcare system, access or finances, we can sometimes help you a little more maybe because my team and I have dealt with it a lot. For fun, when I'm not at work, I'm a gamer. So I'm not one of those people who is like, oh, I go on vacations and I go hiking. No, most of my best vacation time is spent at home. I also read, so it's not like I'm just in front of my console, but most of my time is kind of introverted. So every Christmas, I get a ton of books, and then at my birthday, I get a ton of books, and I work through them the rest of the year. My home office is a massive library, and I love it. I'm Dr. Jason W. White, a family medicine physician with Community Physician Network since 2021.